Thank you. Good morning, everybody. My name is Sue Allan, so I'll stand near the microphone. Some of you may have been here yesterday and you may have heard Beverly Bryant introduce the launch for the NHS e-Referral service. Would you mind just giving a quick show of hands for those of you who did see Beverly's presentation yesterday morning? Less than half, so apologies if we go over anything again, but what we want to do this morning is go into a little bit more detail about our vision for a new NHS e-Referral service. And the key driver here, obviously, is trying to move towards a paperless NHS, making paperless referrals a reality. So in terms of why we're doing this, the main reason, obviously, is to support all the strategic drivers that we have to work with in the NHS all the time. Key one, as I said before, creating a paperless NHS by 2018. There are many others. I'm not going to go through and list them all one by one. I'm sure you're all familiar with them. But those are the reasons why we're doing what we're doing, but ultimately we're here to improve patients' care and make the NHS a more efficient organisation. So let's take a little step backwards and look at where we are now and how a lot of referrals are managed in the NHS on a day-to-day basis. A lot of referrals at the moment are still handled on paper. The NHS processes around 17 million referrals every single day, and around half, as I said, still by paper. So what's this doing? It's causing a lot of time, a lot of waste in the system, and making a lot of effort and inefficient processes. Also, what that does to our systems, it can add an extra 2 weeks to process a paper referral, adding it onto a patient's pathway. So hopefully you'll all agree that it's not an efficient use of our resources, our time, and it's not a good service for patients. So we need to think about doing things differently. Why should we move to doing things electronically and digitally? Everything is much faster when it's done electronically, it's safer, and it's also much more secure. You can't lose anything when it's in an electronic system in the same way that you can lose pieces of paper that go through the post or fax machines. And we all know about the safe haven fax machines where the paper comes out of the fax machine and just goes under a cupboard on the floor. It's not safe, it's not secure. We need to do something about it. And most of our lives, everything that we do, we interact electronically with systems. We don't rely on paper as much as we used to do. An everyday example, there's been a lot of talk about how you book flights. So let's use that as an analogy. Would you go to a travel agent? Some people still do, but on the whole, we probably wouldn't. Would we ring round the airlines? I don't think so. You probably wouldn't get through to them even if you can find the number. Or would you go onto the internet and do it in one place? And I think we probably would. So why should we expect anything different from our healthcare? Why should we rely on bits of paper and people handing these around the organisations and from one organisation to another? So we've got Choose and Book. Many of you will be familiar with the system, some of you may not. Where are we with it today? It's been around now since 2004. And during that time, we've processed over 40 million referrals, so not an insignificant amount. There are over 47,000 services on the Directory of Services around the country, and every day we're processing around 40,000 referrals through Choose and Book. So it's here and it's being used. We know there are some good parts, we know there are some bad parts. What we've got to focus on here is looking at the positives and looking at how we can build on these for the future. So what we've got to work out as an organisation is how we can build on this, how we can learn from the successes of Choose and Book, but we must also learn from the failures, and we must take on board the criticisms that we've had from users of Choose and Book, and we must learn from those, move on from those, and hopefully build a system in the future that supports all those strategic drivers and our principles as well. And the principles of the new NHS e-Referral service, hopefully you'll agree with these, and some of you may have heard of them yesterday. We must improve patient outcomes. That's one of the main aims of the NHS as a whole. We must improve the experience that patients have. We must think of ourselves as patients, because we could be at any point in our lives. Would we expect a service that happens as it does in many places now, relying on bits of paper, time delays, patients not knowing what's going on to them, being told that they're being referred and then not hearing anything for days or sometimes weeks? I don't think we'd accept it from anything else. We wouldn't expect to go into a travel agent and be told, well, yes, you can have a holiday, but we'll let you know where and when you're going to go. It just wouldn't happen. We must, as I said before, we must build on the benefits, build on the successes, learn from the failures. We've got to get rid of this mixed economy of paper and electronic. It's actually more expensive managing two processes than it is managing either one. But then obviously managing everything digitally and through electronic processes is going to be much quicker, safer and cheaper for the NHS to process. Ultimately, we must listen to the NHS. We must listen to patients. We must listen to users of the system. Find out what they want. And this is a little bit about what we're going to tell you about this morning, what we've been doing so far. So we've had a lot of discussion with users of the current Choose and Book system. We ran a range of workshops last year towards the end of 2012, and we spoke to lots of different people around the country. We spoke to patients, obviously. We spoke to clinical commissioning groups, or PCTs, as some of them still were at that time. We spoke to commissioners, and we spoke to service provider organisations. But we don't feel we've spoken to enough people. We want to speak to as many people as we can, use current users and future users of the system. And that's what we're here to do this week here at the commissioning show. What we've heard, we've captured so far. Stephen's now going to talk us through some of the feedback we've had from some of the people we spoke to towards the end of last year, and then we're going to take you through a little bit more detail, and we'd welcome some feedback from you as well. So I'll hand over to Stephen.
Okay. Thanks, Sue. So as Sue said, we've been around the country, we've listened to groups of patients, to referrers, consultants, commissioners, and we're just going to share with you now some of the things that we've heard. We're not going to go into them in detail now. We'll tell you towards the end of the presentation how you can come to our stand and how you can take part in the future consultation that's going to take place on this vision over the next few months. But just to summarise, patients have told us a few things. They've told us that they'd like to, for example, book all their appointments online. They'd like to be able to use modern technology, phone apps, alerts and reminders. They'd like to be able to book follow-up appointments so that they're not, so that they can take the step of booking a first outpatient appointment one stage further and be in control of their follow-ups. They'd like to have useful information, and they'd like to be able to do it all online and in a secure way. What have CCGs told us? They told us that they'd like to focus on getting more information out of the system. So currently, the 40 million referrals are all accessible in terms of analysing what's happened to patients, but they want to be able to get that information out in a more meaningful way to help commissioning needs of the future. They want to have better referral management support for their clinicians within their CCG areas. GPs have told us that they want more in the system to help them get the patient into the right place. So suggestions are to have referral templates as part of the referral process, to have maybe decision aids. They've asked us for an enhanced advice and guidance, and we're going to focus on that one in just a minute. They want diagnostic services to be on there, and they want a seamless integration between GP clinical systems, the central booking system, and the hospital system at the other end. And finally, the consultants that we spoke to in the consultation so far, they've told us again that they'd like better integration with our hospital and provider system. So currently the information gets into Choose and Book, but to get it out the other end into the hospital system is next to impossible. They just print it out, scan it, and put it back in again to the hospital system. So not very efficient. They'd like to use the system appropriately within the constraints, the commissioning constraints, to do onward and tertiary referrals. And again, if you come to our stand, we'll show you one of our scenarios that cover that. So based on what we've heard so far, some of those ideas, what we've done is we've tried to bring them to life a bit. We've tried to create some patient-centered scenarios that we can use over the next 5 months to consult with our colleagues in the wider NHS and say, do you agree with this vision that we've created based on what we've heard so far? Because we don't want to do this to people, we want to do it with people. We want you and everyone else in the NHS to be on board with this and contribute to it. And if you think an idea isn't good, we want to hear from you. Similarly, if you've got some new ideas, and we were very pleased that yesterday, following Beverley's launch, lots of people came to our stand and they came up with some new ideas that we hadn't heard. So this is very definitely an ongoing process that we want to build on. So I'm just going to show you one of these patient scenarios now. It just lasts a couple of minutes, and then what we've got are some consultation questions that we've designed to go alongside each of the scenarios that we want to not test out on you, use with you for the first time today, because the consultation process has started now, and so we're going to use those questions to see what you think. So it's going to become interactive. So I'm just going to play you the clip. Let's hope it works.
What happens to Mick, our 56-year-old teacher, is an everyday occurrence, and this story describes how an electronic referral service of the future could support a typical pathway which results from a visit to his GP. Mick experiences a bit of a funny turn while lifting boxes and decides to see his GP to put his mind at rest. Dr. Singh examines Mick and finds nothing abnormal, but would like to have an ECG carried out. The service displays a list of options, and the doctor asks Mick if he has any preference about where he wants to go. Mick replies, "Wherever you think best." Dr. Singh wants to know the result as quickly as possible, so he helps.
What's happened? Do I press the button again? No, hold on. Back. So you're going to have to listen to it again.
What happens to Mick, our 56-year-old teacher, is an everyday occurrence, and this story describes how an electronic referral service of the future could support a typical pathway which results from a visit to his GP. Mick experiences a bit of a funny turn while lifting boxes and decides to see his GP to put his mind at rest. Dr. Singh examines Mick and finds nothing abnormal, but would like to have an ECG carried out. The service displays a list of options, and the doctor asks Mick if he has any preference about where he wants to go. Mick replies, "Wherever you think best." Dr. Singh wants to know the result as quickly as possible, so he helps.
I gather this is streaming over a link from the office up there, and I don't know how to make it play the rest of it. Can we run it from the actual? No. Okay. Okay, well, let me describe what happens. Sorry.
Stopped at the same place.
It did, yeah. It worked all right when we let me describe what happens. You have to come to our stand, JJ20, all right? Come and see it and we'll play it to you. What happens is that he goes to his GP, as you can see. GP logs on. Because he wants an appointment that day, the GP helps him actually book the appointment. Patient goes off, goes to his ECG appointment. The ECG is is taken and is transmitted back to the GP. It shows an abnormality, so the GP wants to get a further opinion on the ECG. So he sends it with a request for some advice and guidance to a consultant cardiologist, who says that they don't have enough information available. So currently Choose and Book at this point stops, and a consultant can't ask another question back of the GP. So with the new system, from what we've heard, people want the conversation to become two-way and backwards and forwards until there's an answer. So the consultant asks the GP and says, "Have you got any previous ECGs that I can compare it with? And have you got the patient's past medical history so I can see what else has happened to the patient?" GP secretary uploads all of this information, sends it back to the consultant. The consultant has a look at it and says, "Yes, this patient needs a referral," sends that information back. The GP gets an alert, and this would be, it could be a text alert if a GP wanted to be reminded by text, or it could be on a mobile phone app, or it could be an email saying you've got an advice and guidance response. GP contacts the patient and says the consultant has looked at your ECG and wants you to see a cardiologist. So they go online together, give Mick a choice of a number of providers where he could go. Mick gets that information beamed to his mobile phone app. He uses the app to select whichever one he wants. The information, the clinical information, is then transferred to the consultant. However, I'm trying to remember the scenario now. In booking the appointment, the GP has been alerted that not only does the cardiologist need to see the patient, but the cardiologist has indicated they want to have an echocardiogram booked for all such patients according to the clinical details. So as well as booking the cardiology appointment, the patient gets alerted to book an echocardiogram appointment. such that when the patient turns up for the cardiology appointment, the echo is there as well, so that it's not a wasted journey. So that's the scenario. You should have seen that all in the animated version, and I don't know what ever happens. I could see some of you laughing. They're probably saying that's as reliable as Cheers and Book. Well, I can tell you the e-referral service of the future will be a lot more reliable than anything that's gone before it.
Go to your store then, look at it properly.
Yes,
Yeah.
come and look at it. I can promise you it's because of the streaming over the link that it hasn't worked, but it will work, and come and see it on the store. Let me take the question now that you've. I'm not going to play the game. Oh yeah, right. Now that you've heard the story, let me take you through some of the questions that we wanted to consult on. We probably won't get through all of these, so again, if you come to the stall, please come and talk to us and give us your views. So the first question would be, would the ability to send outcome or discharge information? So remember I told you that ECG, I had an ECG done, instantly that ECG result is back with the GP. So we've heard from clinicians that we've spoken to that they want the same system to transfer the referral information and to be able to transfer the outcome or discharge information back again. So our first question, and I don't know who's got the roving mics, yeah? Our first question is, would it be useful to have the same system be used to transmit referral information and discharge information? Any views on that? Is that yeah?
Hello? Maybe in certain situations and maybe not, so it depends on, for example, people, I'm not very sure. Okay, yes, certainly in certain situations it could be. Certain situations, maybe you're complicating the whole process. Maybe duplicating, complicating, making unnecessary referrals, unnecessary further investigations. You might be overdoing things. There's a risk of that, I think so.
Okay. I was very sceptical as to, I was very sceptical as to whether it would be useful, because in my practice we get most of our discharge information back through another means anyway. However, people said to us when we were gathering these ideas, they said, well, what about this choice where patients can go to any hospital around the country? How will you be able to get information back from all those other hospitals? And that was a very good point, I thought, that was being made. So, point.
Why not use the patient as the single common factor in all of these interactions? It wouldn't matter then whether the patient chose to go into a walk-in centre, a GP surgery, an accident emergency department when they were on holiday. If all of the information went back to the patient's cloud, then all of the healthcare providers having contact with that patient would have access to the same information.
Okay, that's a good point. Thank you. We're capturing all these points. So, anybody else want to talk about referral and discharge information using the same system? Otherwise, I'll select another question. So, I described to you the advice and guidance facility that currently with Choose and Book, it's one question and one answer and stops. With the new system, it will be one question, one answer, one question. As long as the two parties want to carry on that discussion, and information can be uploaded. So, as I described in the scenario that you didn't see, the patient's past medical history and previous ECGs were uploaded in response to a question from the consultant back to the GP. Do people think that would be a good idea? If you've
I think there'd be some concern that, if I want advice on a problem, I usually go to somebody I know, and I might say, I've got an issue here, can you sort it out? I think if we're just transmitting backwards and forwards, in the cloud, there's a risk that the thresholds and risk management is going to be changed, and I wonder whether we'll end up having more referrals into the system as a result of that.
That's an interesting concept, because certainly there's quite a number of former PCT and our CCG areas that have not forced advice and guidance to be used, but sort of strongly advised that it is used as a referral management tool within their areas for precisely the opposite reason, to reduce the number of referrals. So there's some nodding going on here, and some CCG areas that have done that have come to us and said there's a real significant reduction in the number of referrals by facilitating GPs to ask questions of consultants. But they've said, but we need that dialogue to go on longer. Any other points on? So one here, and then where was the other one?
Hi, I'm Ahmed Mike from Mid-Essex CCG. I'm a GP. I've been privileged to be able to have a select group of consultants which I can email and chat to and get advice, and also compare it to choose and book guidance. Choose and book guidance, you tend to get defensive advice to say, and they say send to hospital. Whether you've got a consultant you normally get advice in one hit, and you get the appropriate advice. So the only problem is if you're using existing services, you may end up creating more work, more cost to CCGs, and not actually what we're after, which is kind of better care closer to home.
Can I just ask, do you think that is because, though, a part of that defensive response, do you think that's because they can only come back with one thing? Because I have to say, I've seen that too, but I do wonder whether if they had the ability to say, well, you haven't quite asked that question in the right way, can you tell me this instead? There might not have been the just send them to hospital response. I don't know.
It could be. I guess part of this is relationships, and if you've got the relationships, you can build technology around that to sort of enable it. Once you make it one system, then you tend to kind of just get sucked into a big machine, and it's fairly anonymised.
Okay. Next up, we've got about 3 minutes left.
Oh, okay, fine. We have indeed. So.
I'm Dan Doherty. I'm from Mid-Essex CCG as well. The concept's fantastic. One of the issues that hospitals tend to raise is there's issues around the timeliness of response. So whilst the technology exists and you can go to and fro as much as you like, it's no good if you ask for advice and it doesn't arrive until 6 days later. So contractually you can hold, providers to account, but the reality is you're still dependent on individual consultants responding in a timely manner. And then secondly is the issue for them in terms of their own kind of workflow management, in terms of do they allocate a certain amount of time per day to respond to advice and guidance requests? And if they do and they get none, they're doing other things. And sort of payment mechanisms for what constitute, is this ECG abnormal? No. What's the payment mechanism for that versus a conversation that goes on over a course of days that says try this management, try this, so on and so forth. So it's, whilst the kind of technology and the system would be beneficial, the mechanisms around contracting for it and charging for it for hospitals would need to catch up with the technology.
But isn't it worse, the present system? I mean, that fact that you'd said that it adds 2 weeks having a paper referral, at least with an e-referral you can pester them more about getting a response.
Saying you need to make sure that the technology doesn't outpace the mechanism in order to kind of measure it, if you like.
Okay, well, thank you for that. Sue's just going to wind up and tell you how you can come and contribute. So thank you for your discussions today, and sorry the technology let us down a bit, but we'll...
There were obviously more... Is this switched on? Yeah. There were obviously more questions that would have come out there, so we really would encourage you to come back to the stand, come and talk to us. We can show you the scenarios properly, and we can go through these questions with you, because your feedback's really, really important. And some of the things that we've heard already, as Stephen said, are ideas that we hadn't thought of. Involving the patient in all this online dialogue as well was another suggestion that we've had. And why shouldn't they be? So I think please do come and talk to us. We're on JJ20. You can meet the other members of the team. We're here to support you currently and in the future. And we'd like to have your feedback. We've got a great big feedback wall which was attracting a huge amount of attention yesterday. So please come and put some stickers on that for us and let us know what you think. It's really important. If you don't get a chance to do that, or in addition to doing that, we've got a new website where all these materials are available, and I promise you they do work. So please have a look at them on the website. There's storyboards and there's animated scenarios. And we will be arranging workshops. We're wanting to do them all over the country. We want as many people involved as possible. So again, if you'd like to be involved in one of those workshops, please come and let us know, or send us an email, and then we'll get back to you through that route as well. So thank you very much for your time this morning. Sorry about the technology again, but promise you that it does work on the stand. Okay, thank you.
Well, thank you, Sue and Stephen. So we better move on. If you could take all your papers with you, enter the passport competition, and enjoy yourselves.